Hi, Dr. Leah here with some more health information for you. Today's topic is our friend vitamin D. Its most known function in the body is to maintain our balance of calcium and phosphorus and keep bones strong. Vitamin D increases intestinal absorption of calcium from 10 to 15% up to 40%, and absorption of phosphorus from around 55% up to 80%. Severely low vitamin D can cause weak and deformed bones, known as rickets, in children, and osteomalacia, which is softening of the bones in adults. Vitamin D occurs in two major forms, which includes vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. D2 is synthesized by ultraviolet B radiation of the ergosterol found in yeast and fungi such as mushrooms, where vitamin D3 is obtained by a photochemical reaction in the skin or through diet. But natural dietary sources of D are limited to only a handful of foods, like egg yolks and oily fish such as salmon and cod. Aside from being absolutely crucial for healthy bones, it's been discovered that vitamin D has a myriad of other important roles it plays in our health: cardiovascular function, immune system function, muscle strength, and brain development, to name a few. Many studies are coming up with evidence that having low vitamin D is associated with developing cancers of various types, including ovarian, prostate, esophageal, lung, colorectal, renal, pancreatic, and melanoma. Go figure, right? Here we have been told for years to avoid the sun to reduce our risk of melanoma, but having low vitamin D, which of course you get from the sun, increases the risk for cancer. What's more, we now know that vitamin D plays a role in health conditions such as diabetes, hypertension, and autoimmune disease such as lupus, MS, rheumatoid arthritis, Hashimoto's thyroiditis. Vitamin D regulates several physiological processes in the skin, and deficiency has been linked to many skin pathologies like dermatitis, vitiligo, and psoriasis. You might be wondering, what about seasonal affective disorder and depression? Vitamin D does play a role here too. Brain cells in the areas of the brain linked to the development of depression contain many receptors for vitamin D, and it's believed that D may increase the effects of monoamines such as serotonin. Adequate vitamin D is crucial for a healthy pregnancy as well. Low D levels have been linked to higher risks of C-section and preeclampsia, which is pregnancy-related high blood pressure and protein in the urine and swelling of the extremities. So why might someone's vitamin D levels be low in the first place? Some causes are lack of sunlight exposure, genetic mutation in vitamin D receptor gene, melanin content of the skin, darker skins associated with slower vitamin D production, kidney or liver disease, decreased absorption of vitamin D in the gut. About 90% of nutrient absorption occurs in the small intestine. So if there's any inflammatory condition of the intestines or malabsorption, this poses a problem. The good news is that it's so easy to get your vitamin D levels checked and optimized. A simple blood test can be ordered by your primary care doctor or naturopathic doctor. Increasing safe sun exposure or supplementing your diet with vitamin D3 is the solution if your levels are found to be low. The lab's normal reference ranges are 30 to 100. However, optimal levels associated with risk reduction of the health conditions I just talked about need to be at least 40 to 80. Supplementation dosing ranges from 500 IU per day to 10,000 IU per day, depending on age and weight. It's important to have follow-up testing after you begin supplementing with vitamin D to make sure you're taking enough, but also not too much, because it is a fat-soluble vitamin. And it's possible to take too much and get vitamin D toxicity, causing hypercalcemia or too much calcium in the blood. It really is best to make sure your vitamin D is from the sun if possible. D made in the skin lasts 2 to 3 times longer than ingested vitamin D. The Vitamin D Council's recommendation is 5 to 15 minutes, 3 times a week, between the hours of 10 a.m. and 3 p.m., with at least 35% of your skin exposed to the sun. Sunscreens block the skin's absorption of UVB radiation, so consider delaying putting on that sunscreen until after you've had your first 15 minutes in the sun. More information can be found online at vitamindcouncil.org. Thanks for tuning in today. Until next time, be well.